Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Muscle spindles. So under the muscle spindles, there is a stretch receptors. So stretch receptors within the muscle, they are known as the muscle spindle. And they are present in all skeletal muscles. Muscle spindles are the main component of the stretch reflex. And there is a myotonic reflex. There is a myotonic reflex. The stimulus for the stretch is a passive stretch. The muscle spindle density is higher in a muscle associated with the fine movements. So in case of fine movements, the muscle spindle density is higher. And eye muscles, that is fine movements, that is includes the movement of the eye as well as the lumbricals. Next, the muscle fibers within the spindle are called as the intrafusal fibers. Intrafusal fibers, that is, it includes the nuclear bag fibers, and the nuclear chain fibers. Next, to differentiate them from the regular or the extrafusal fibers, that is a contractile muscle units. Next, the intrafusal fibers are parallel to the extrafusal fibers but have no contractile functions. So intrafusal is parallel to the extrafusal fibers but have no contractile function. And the central non-contractile part of the muscle spindle contains the receptors, whereas the peripheral part contains the contractile elements. So peripheral, it has the contractile elements. The various factors that increase the gamma motor neuron discharge are the stimulation of the skin. So skin stimulation. Next is the Jurassic maneuver, then anxiety as well as unexpected movements. The mechanism of the muscle contraction in response to stretch reflex. So as soon as the stretch of the muscle is performed, the stretch of the muscle as an intrafusal fibers are present parallel to the muscle fibers. So intrafusal is parallel to that of the muscle fibers. And there is distortion of the primary secondary endings. So distortion is seen, and this is of the primary sensory endings and located at the center of the nuclear bag fiber. So it is at the center of the nuclear bag fiber, and there is a generation of action potentials to the afferent fibers. So there is generation of action potential to the afferent fibers, and then the stimulation of the motor neurons in the spinal cords. The stimulation of the motor neurons, and this happens in the spinal cord, and ultimately it leads to the muscle contraction. To learn and grow daily like this, please do subscribe.